Hello everyone. Today we'll be talking about ECG in left atrial enlargement. So left atrial enlargement is basically occurs due to pressure or volume overload of the left atrium. It is often a precursor to atrial fibrillation. So normally the left atrial, so this is a normal P wave. So the first half of the P wave occurs because of the right atrial depolarization. The second half is because of the left atrial depolarization, and the middle part is because of the both of right atrial as well as the left atrial depolarization. So if there is right atrial enlargement, the first part will get heightened up. That is peak P wave. You can see here in right atrial enlargement. But if there is left atrial enlargement is there, so normally right atrial enlargement is normal. So right atrial depolarization is normal. Thus first half of the P wave is normal. But the second half, because left atrial is very much increased, the mass is increased. So the height of the second half is also increased, and also the duration is increased. So there will be bifid P wave with duration of P wave is increasing here. That is in the lead 2. And suppose you want to see it in the lead V1, then what will happen is the first half. So in lead V1, what is there is the first, this is P wave is biphasic. The first half of the P wave is basically because of right atrium. The second half of is because of left atrium. Normally both of them should be equal. Here you can see the left atrial part, the second half of the P wave is increase in the duration as well as in the depth as well. So in ECG, if you are considering lead 2, there should be bifid P wave, that is bifid P wave, one P and second P, and the duration between both the P wave, this peak of the P wave duration should be more than 40 milliseconds between the two peaks, or total P wave duration should be more than 110 milliseconds, or more than 3 small squares in ECG. If you are considering in V1, lead V1, as I have already said, that is biphasic P wave with terminal negative portion more than 40 milliseconds duration. This is more than 40 milliseconds duration, that is more than one small square. As well as if it is negative terminal portion is more than 1 mm deep, that is more than one small square. If it is more than that deep, then it is called as left atrial enlargement. So you can see here the duration of the negative P wave, the second half in V1 is more than one small square, that is more than 40 milliseconds. Here you can see the second half of the P wave in the lead V1 is more than one small square, that is more than 1 millimeters. It is suggestive of left atrial enlargement. And this is P mitral, where the you can see there is two P waves. You can see peak of two P waves. You can see here the first and the second P waves, and the duration is also increased here. So what are the causes of left atrial hypertrophy or left atrial enlargement? Is most commonly it is mitral stenosis in isolation, or it may be found in association with the other left ventricular hypertrophy as seen in systemic hypertension, aortic stenosis, mitral incompetence, and hypertrophic cardiomyopathy. So there are two important indices which are very important in ECG for left atrial enlargement, that is called as Macruz index and Morris index. So what is Macruz index? Index is a proportion between the P wave duration and PQ segment. So it is a ratio of the P wave duration with the PQ segment. This is the PQ segment here. So we are not taking the PR interval as such, or we have the segment of the PQ here only with the PQ segment is there. So normally the ratio of this P by PQ is more than 1 to 1 is between 1 to 1.6. In case of left atrial enlargement, this ratio is increased to more than 1.6. That is, P of duration is increased very much. So that's why this ratio becomes more and more up, and more than 1.6 if it is there, this ratio, then it indicates left atrial enlargement. Morris index is a parameter that suggests left atrial enlargement. It is also used for left atrial enlargement. Here what we do is we take calculation and we multiply, it's an amplitude, that is the amplitude of the P wave. In lead V1, the amplitude of negative P wave, amplitude of this P wave in millimeters is there, and then the duration, and also the duration of the P wave. So what you do is we multiply the in millivolts, that is product of the amplitude in millivolts on vertical axis, and the duration with the duration in the duration in milliseconds on the horizontal axis of the calibrated paper. So you multiply both of them, that is negative, and if the duration is equal to or greater than 40 milliseconds, if this ratio comes to be more than 40 milliseconds, the duration, the multiplication of this depth into the duration, if it is comes to more than 40 milliseconds, then it is suggestive of left atrial enlargement.